Namaskar, I am Sanjeev Pandya welcoming you to the Ayurveda Mantra Show. As you know, every week in this show, we talk about importance of Ayurveda and the Panchkarma with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers in USA. Dr. Nair has over 30 years of experience in treating individuals through Ayurveda, herbs and Panchkarma treatments, and she is the one who gives us valuable suggestions and guidance when it comes to Ayurveda every week. I'd like to welcome Dr. Ambika Nair to our show. How are you, Doctor?
Yeah, I'm fine, Sanjeev. Thanks a lot for inviting me again.
Yes.
Hello, viewers. Hope you all are enjoying my show. And there was a special request, Sanjeev, about from my few viewers that they wanted to know about endometriosis, how we are able to manage through Ayurveda, because so many people will be going for the surgeries and all, and with the complications they come to us.
Endometriosis. As far as I know about endometriosis, which is a painful chronic disease, and that affects about 6.3 million women and girls in USA, about 1 million in Canada, and many more millions worldwide. So it's a good that our viewer has sent in a request to talk about that topic. What is endometriosis?
Endo means inside.
Okay.
Okay. Exo means outside.
Achha.
So this is endo means inside the uterus.
Okay.
See, every month, how the ladies, they get the periods means this endometrium will be shredded out. This is in Ayurveda, we call it as, like with your, like apana, vata. Because like how the force, how they force it out.
Okay.
Okay, so like that comes and, it goes out. But in this case, it will grow outside these tissues will go because of the certain obstructions.
Achha.
This will start, like moving upwards.
Correct.
Like, it will come to the fallopian tube, like the ovaries, and even outside the uterus, like that only. And not only that, scar formation also will be there.
So what's the duration of that when it comes and goes in between there? What's the duration of the pain that stays?
No. Actually, it will be the person, like it is seen, there is no age, like mostly it is seen between 20 to 40, 42. Okay. Because at that time, when they are fertile only it will come. Before the periods, nobody will get this. Even after the menopause also, nobody will experience this. Okay. They will be complaining of very bad low backache. Backache in the sense they have no way they can stand.
So these are some of the signs and symptoms.
No, this is one of the signs actually. Signs are so many, like so much bleeding also will be there. That is, like dysfunctional uterine bleeding will be there. Not only that, like that endometrium, that will become like a thick, like a rod shape. It's like a scar tissue. Like after the surgery, how sometimes, you can see like a fibrosis, the same way it will become like that. And it's very difficult even for them to pass urine. Even sometimes they will have frequency of menstruation, heavy bleeding. Because of that, they can even get into anemia. This is all there.
What causes endometriosis?
Normally, it is, like even little bit hereditary also it is there if the mother was having any issue like that with the hormonal imbalance. This is all because of the lady's hormone. That
and then how do you diagnose and manage through Ayurveda?
That's a very good question. Actually, nobody will come directly to the Ayurvedic doctor. So they go everywhere, they come with all the reports of the, ultrasound, everything they will be bringing, their blood work and everything. So they will, when they cannot afford to, stand more pain, then they will come because they will be on pain medication for a long time. There is no other way how they can do or the surgery. Okay, so we do the diagnosis just by looking at them itself, we will understand more. Okay, so with the pulse analysis, we diagnose them properly, and there are so many treatments available. Not only with the Panchakarma, we will be doing the diet also, preparing them for the Panchakarma, and these people will be so irritated, because of this all mental agony what they go. They will be under severe depression, fatigue, because they want to do the things, but they cannot do it. That is another way, it's like, it's very tiring.
How common is this in our South Asian community?
It's very common these days. Actually, one of the important causes are because they always do the planning. Planning means they will be they keep on doing the planning only because like they keep no child will be born for like 8-9 years. So it's like a barren land, you know. So this also we have seen that because when they plan later, they will have so many issues like that.
Is there any side effects to this endometriosis?
Yeah, because they will not be able to lead a proper, you know, married life. Like it will be the intercourse will be very painful and all. Not only that, you know, like because of the fatigue and all, and even the irregular bleedings, it will be very difficult for them. And bleeding also, because it will be an interrupted bleeding. Some few days they will bleed, again they will stop it, then again it will come like that, and heavy bleeding with the clots and all.
Do you really think that ladies, you know, or girls rather, they really come out and talk about this if they have that, or they accept it as a like it's a natural thing?
No, they come and talk. They come nowadays. Actually, see, before, you know, like people were like shy to come and talk. Now it's not like that.
Okay.
Even, you know, like they talk about this in the, you know, family, and they really come and take the care of that actually, mostly because they come and we really take care of them.
Yeah, because it really sounds like something very, very painful.
Yeah,
I mean, it must be difficult for a person to endure that pain.
They can even faint because of the pain.
Really?
The pain is such a bad thing, you know, they cannot even stand. They will just faint.
All right, so that pain, it's
trembling of the legs.
It's a physical pain, but mentally it affects person also.
Not only the pain is such, you know, they cannot even stand. They cannot do their duties also. That's why they take a lot of painkiller and go for the duties.
Okay, and girls at what young age that you have seen getting this endometriosis?
Okay, endometriosis I have seen after age of like 19.
Wow.
Yeah, 20. But otherwise, you know, like they will have little dysamenorrhea, like during, you know, like a painful menstruation. So when they come and talk only, that we will see that whether it has to be arrested then and there, you know. Otherwise, we tell them to watch how the bleeding is there, how it is coming, whether you have any, you know, like some people during the periods itself they faint. So this all related with the cervix only. So that we take care with that.
All right, viewers, we're talking about endometriosis in this episode, Ayurveda Mantra Show on TV Asia. We're going to take a short break. We'll be right back after these messages. Welcome back to the Ayurveda Mantra Show. In this episode, we are talking about endometriosis. And before we talk about endometriosis, I just want to point out one thing that Dr. Nair, our viewers are watching this show and they're finding this show very, very useful, very informative, and they are sending their comments and suggestions. And through that, we got a request from a few of our viewers, right? And they actually requested Dr. Ambika Nair to talk about endometriosis, and that's what we are talking about. A disease which is becoming very, very common among women and young girls. Before the break, we talked about the symptoms and what really is endometriosis. Now let's find out what causes endometriosis.
See, in Ayurveda, when we talk about that, because it should be diagnosed in a proper way, whether it is related with the kapha problem. See, like all the three, you know, like vata, pitta, kapha, it is there. Mostly it will be with the kapha, okay, kapha origin. Okay, and it can be even with our pitta also, because the bleeding, okay, and even next is vata, because the flow has to go.
Correct.
But here the flow doesn't come. Instead of that, you know, it makes an obstruction over there, and you know, like then so much bleeding. See how it will happen. I'll tell you. It has to bleed and it has to be out. Okay. But here, because the endometrium is placed so many outside of the, you know, like a uterus. So
it
whenever, it is actually outside the uterus also. So whenever the hormonal changes comes, it always comes on them. Okay. So they bleed it, but the outlet is not there.
Correct.
So naturally, because that is the pitta concerned. Okay. So that will stay over there. and the scar tissue formation will be there, because it will be a very sticky fluid. Okay, so that's very, like a very painful, and inflammation comes. That's it. The patient will always have fever, all those things, like low grade fever they will always experience, and before starting the periods also they cannot even go and pass urine. After passing urine they feel like going again. Like in 1 hour they will be going like 7 times minimum.
Wow, really?
Very tired, very tired. They will have pain on the thighs, pain on the, like on the legs and everything. It's very, like they really suffer a lot. Okay. Then again when it is not pushed, that area become very dry. Dry in the sense, like, so they cannot even, or like the family life will be affected with that.
Can you share with us any patient's condition that you came across, and even you found it very, very painful, and then perhaps you couldn't believe that how that person was enduring that much of a pain?
Yeah, because we get so many cases like that, and once somebody came to my clinic, and we were doing the therapy over there because she had some other issues like low backache. So she told that they have taken online only, that I just want the low back. But during the therapy, she started getting this pain. So I was called inside. Then I was asking her about that. No, my periods is okay. I told, it's not like that. Let me have a look at you. Then I diagnosed her and I asked her, your periods are not right. You get the pain. She told yes. Okay. And she was in such a condition, she could not even move from there. Then, her mother told, it happens. Mother was sitting outside. Mother told, please call, then she called by the time 911, and she was taken to the hospital because that was the pain.
That was unbearable pain.
Unbearable pain in the sense, it was so horrible that girl could not even sit. Like when I am seeing itself, like she is fainting.
My God.
Yeah, it was very horrible actually.
My God.
Yeah.
Okay, through Ayurveda, how can you cure this endometriosis?
Okay. Okay, like in Panchakarma, see there are so many herbs also in Ayurveda, but because we are in the Panchakarma unit, so we like them to take even herbs also and even Panchakarma treatments also. If it is how the hormonal imbalance comes, means it will be related with the irregular periods and even with the polycystic ovarian disease. Not only that, this will always lead to infertility. Yeah, because that we have seen a lot of cases, like they get into infertility because it's very, very disastrous, like very, very tiring disease actually. You cannot even stand.
Gotcha.
Okay. Then we do in this we will be doing, first of all, if it is related with the kapha, means we will start giving them snehapanam, like snehanam. So that the virechana, like a vamana can be done. Okay. So their kapha balance will be there. Then we start her with the proper diet. We tell them how to go with the, no need to take any outside food.
Gotcha.
Outside food means it is very, very different also, only khichdi. We can tell that, like sirf khichdi khana hai. 2-3 दिन समझ रहे हैं ना 2-3 दिन
how long
3 दिन का so that it will pacify their pitta. Okay, so that will be taken care, and no raw food, कोई raw like salads or anything कुछ खाने के लिए हम मना कर देते हैं. And they should have we give them according to the situation, we give them even Shirodhara also to pacify them, because their mental agony will be very bad.
Is this pain recurring, meaning can it come back after a month or 2 months or 6 months?
Yeah, that's what, see, like after the treatments, like then we give the important treatment what we give is that Uttaravasti, like Yogavasti first in Ayurveda, to clean the pelvic area actually. Okay, so all the toxins, why the disease comes? Because this all comes through the amam, like toxins what you eat and what you keep inside you, mentally and physically, which is making a disease. That is more important actually.
Anyway, viewers, we're going to take a break and we'll come back with more on endometriosis in this episode. All right, viewers, welcome back to the Ayurveda Mantra Show. In this episode, we are talking about endometriosis, how common this endometriosis among women and young girls. And Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers in USA has been giving a lot of details on this endometriosis. Now we know that endometriosis can be cured through Ayurveda. Now let's talk about Panchkarma. What is so special about Panchkarma treatment for endometriosis?
See, why it is important, I'll tell.
Gee.
Because actually people only think about the pills.
Correct.
But it's not.
Yes.
You can do so many things at home also.
Achha.
Okay. When your mother is suffering, so we should always think that our daughter should not suffer like that. So if this attitude is there, then you work for that.
Achha.
Okay.
That's a good point you brought in.
Very sincerely telling, because so many people, I don't know, they come and talk to me like this, doctor, I don't want my child to suffer like me.
Correct.
Okay, nowadays the concept has changed a lot. So that I also feel very happy with that actually. Okay. Then in Panchakarma, I told you about what Vata and all we will be doing. Okay. So we will ask them, to take like a castor oil. Castor oil related, we have certain medicines also. But if not, we tell them to take 1 tablespoon of castor oil every day at night before they sleep. Okay. So this will also, induce Vata because that Apang Vata is, totally obstructed there. So it has to overcome. Okay. Then it will start moving. Okay. Then it helps a lot.
Okay.
And we tell them, what they can do at home is with the food, don't drink alcohol. Tip, you should always, we have everything in our kitchen. Okay. You should always take turmeric, our yellow gold.
जब से मैं ये शो कर रहा हूँ और आपसे बातें कर रहा हूँ मैं समझ रहा हूँ कि टर्मरिक इज वेरी वेरी यूजफुल फॉर
इट इज अ रियल एंटीबायोटिक
अच्छा
या इट्स अ गुड एंटीबायोटिक
एंड इट
नेचुरल एंटीबायोटिक
जी एट Santigram Kerala Ayurveda Wellness Centers in the USA, how many people really come with this endometriosis situation?
Sanjeev, I do a lot of infertility.
Achha.
Okay. And my infertility cases are all like IVF failure, IUI failures only. So very chronic cases only come to me. So I should say that like 65% will be like endometriosis.
Achha.
Yeah.
Wow. That
okay.
many.
So it is like that only.
Okay.
Yeah.
All right. Well, now we know that through Ayurveda and Panchkarma, it can definitely be cured. Dr. Nair, before we end this episode, can you give Ayurveda tip, a general tip for everybody, not only for endometriosis patient, but a general tip?
They should drink a lot of water and like raw food should be avoided. If you are having any issues like that and if your digestion is not good, take only cooked food. That is more important. And do little exercise properly, try to sleep properly. Stress, I cannot say don't take in this country because we all are staying in such a place where so much stress is there.
Exactly.
But avoid as much as you can.
Okay.
Try to be happy, at least laugh every day for 1 or 2 minutes. Smile at everybody.
Dr. Nair, as you say that we've been living a stressful life, right? Everyone lives in stress, and I think stress में रहते ना लोग हंसना भूल गए, हंसते नहीं है. और अगर कोई ज़्यादा हंसता है कि थोड़ा सा स्माइल देता है तो लोग समझते हैं कि ये
इसका दिमाग खराब है,
पागल है या कुछ खराब है. But anyway, what you're saying is it correct कि stress तो है ही, you cannot avoid that, right? So basically the point is that you learn to live with stress and live happily with a smile on a face.
Manage it. See, we all are human beings. हम तो मनुष्य है यार. हम like we are not animals.
Thank you. And the viewers, once again, we encourage you and request you to send in your email info@santigramusa.com. You will see it on the screen. That's info@santigramusa.com. Do send in your questions, any questions that any pain or disease or sickness that you are experiencing and you want to know Ayurvedic solution, you can definitely send us an email and we will talk about it in this weekly Ayurveda Mantra Show.